and welcome to the Be Well video blog. Be Well stands for Behavioral Health, Wellness, Environments for Living and Learning. Today on the vlog, we have with us Dr. Lovoria Williams, who is an associate professor at the University of Kentucky College of Nursing, and she's here to discuss lung cancer screening. Hi, Dr. Williams.
Hello, how are you?
Good. And about lung cancer screening, our first question is, what prompted the development of the U.S. Preventive Services Task Force for Lung Cancer Screening Guidelines?
Well, similar to all screening tests, the recommendation for lung cancer screening was made after extensive research. So the research that was conducted was a national study. And what the scientists wanted to learn was high risk for lung cancer individuals. What was the best screening test? Was it chest x-ray or was it a low-dose CAT scan? So the individuals in the study were randomized to receive either a chest x-ray or a low-dose CAT scan. At the end of the research, it was discovered that those individuals who had the low-dose CAT scan, their lung cancer was diagnosed earlier, and later on, their death rate was lower than the people who had chest x-rays. So then the recommendation was made that low-dose CAT scans would be the screening test for lung cancer.
Wow. And can you go more into the lung cancer screening test?
Yes. It's a very simple test. It's done once a year. The individual undergoes a low-dose CAT scan. They lay on a table. No IV is required. They hold their breath for about 5 to 7 seconds, and then they run through the scanner, and the test is over.
And what is the screening criteria?
Well, in order to meet the screening for lung cancer test, an individual should have a history of heavy smoking, and that's defined as a pack a day for 30 years, or it could be 2 packs a day for 15 years, or have quit smoking within the last 15 years. And they must be between the ages of 55 and 80 years old.
Very nice. And what is the current uptake of lung cancer screenings?
Unfortunately, the uptake of lung cancer screening is only about 5%. So that's very low.
And what is that in comparison to other screening types?
Well, other screening tests such as breast cancer screening, those screening tests, the uptake might be 85 or 90%.
Yeah, so it's very different. And so would that add to like the barriers to lung cancer screening?
Absolutely. There are some barriers to lung cancer screening. Number one, as we discussed, people don't know about lung cancer screening. It's our newest screening test, so there's a lack of awareness. That's one barrier. Other screening tests such as breast cancer and colon cancer, people are very familiar with those tests. Whether they meet the criteria for those tests or not, they know about them, but not as much with lung cancer screening. Additionally, it's very hard to determine how much a person has smoked. So in order to be screened for lung cancer, the person must have smoked a pack a day for 30 years. Most people who use tobacco, they don't use a certain amount of tobacco consistently. Yeah. There may be times that they smoke a pack a day for several years, but then they might lower to a few cigarettes a day, perhaps if they have a new child in the home, or if it, in the case of a woman, if she's pregnant. So it's very hard to determine who's at risk and who should be screened. Additionally, unlike other screening tests, lung cancer screening tests, the clinician who orders that test must do a shared decision-making conversation with the person. And during that conversation, they have to describe the risks as well as the benefits to lung cancer screening. And what that means is that requires a visit to the provider to have that shared decision-making conversation. So they can't be screened perhaps at a health fair as they could be screened for perhaps diabetes screening. So that's another barrier to lung cancer screening.
Yeah, that's a lot of barriers. Yeah. And Dr. Williams, do you have any final comments about the importance of lung cancer screening?
Absolutely. We're very excited about lung cancer screening because we believe that it can change the face of lung cancer. Historically, individuals with lung cancer, they're more likely to be diagnosed at a very late stage. And that's why lung cancer has such a high death toll. In fact, it's the biggest cancer killer.
Yeah.
So we're hoping that with lung cancer screening, as more high-risk people are screened, that we will identify lung cancer much earlier and that people's outcomes will improve because we know that early detection does change outcomes more positively.
Well, thank you so much for your insight and your time, Dr. Williams.
Thank you.
And if you're interested in learning more, check out our website at www.bhwell.uky.edu. Thanks for tuning into the Be Well vlog, where behavioral health is our priority. See you next time.